Welcome, everybody. Thank you all so much for joining. My name is Dr. Lauren Snedeker, and I'm the director of the Aging and Health Certificate Program. I'm so glad to be here with you all and to have Dr. Rupa Ketrapal, who's our director of the CIVIT certificate, which stands for the Certificate in Interpersonal Violence. And we're so glad to have this conversation around trauma and aging and older people. We are recording, hopefully. Yes, we are recording, so please be mindful of that. And I'll just invite Rupa to go ahead, share a little bit about yourself, and kick off the conversation for today. Thank you so much.
Thank you, Dr. Snedeker, Lauren, for inviting me to do this. I love collaborating with my colleagues and sort of having this nature of a discussion. I see a lot of my certificate students here, so thank you for coming. And many of you are that close to graduation. Congratulations, nearly there. Thank you, Dean Hunter, for coming as well, and Janice. I see Janice too. So I would like for today we are discussing trauma in older adults, and I am specifically going to be discussing elder abuse and what that looks like and how it manifests itself and the impact. And so what I can do is share my slides. I do want to say before I begin that when Lauren and I had initially spoken about this, wanted to do more like a conversation. I wanted to do like a real quick dump of the slides so that we could go over some of the information and then open it up for more of a conversation. So I'm going to try my level best to cover the material. And again, these slides will be sent to you, so you don't have to take notes and things like that. You can always go back and look at them. Let me see if I can share my screen. Can everybody see it?
Yes.
Okay. All right. Okay. So again, welcome, and I really appreciate your interest in this topic. Those of us who work in trauma and interpersonal violence, elder abuse is a very unusually common and unfortunately common issue that we see. And I'm glad to be talking about this with folks who don't primarily work with trauma. And this is always helpful to sort of see, understand. And we will be discussing today what elder abuse is, the different forms of elder abuse, the prevalence and the scope of the issue, and what the vulnerabilities of older adults are, what their I guess risk factors are for victimization, but also the risk factors for perpetration, because we need to understand violence in a more cyclic way as those who perpetrate violence against others and those who are victimized as well. And sometimes those roles can be interchanged, and we'll talk about that. Let me move this over here. Okay. So I want to begin, as I always do, by a story. So for me, most of what I've learned is from my clients, and this is the story of one of my the clients that I worked with many years ago, and just this is one of many. There's a very similar pattern of situations you will see. So I'll talk about Mary Jane's story. Mary Jane is a 68-year-old married woman and suffers from anxiety and depression. That's what she was referred to me for services. Her husband, Tom, of 40 years, has been abusive towards her for most of their marriage. Mary Jane has a heart condition that she needs to take regular medication for. And she used to have a sister living nearby who recently moved to another state. Mary Jane has 3 children who live very far away, and they visit her twice or thrice a year. The local police have frequently been to the home when neighbors have called after hearing loud noises, but have never arrested Tom, usually due to his age, and explanations that Mary Jane is hard of hearing, so he has to yell to speak with her. Mary Jane hardly leaves her home and rarely has any visitors. They are both retired and live on their pension. Tom is frequently seen at the local bar drinking until late at night. Now, as you hear Mary Jane's story, I'd like you to think about and the first thought that comes to your mind, if you could just put it in the chat. And just don't overthink. Just as you hear a story, what's coming into your mind, just type it into the chat. Yes, isolated, lack of a support system. Is she hard of hearing? Okay. Lonely, isolated. Yeah, absolutely. It's a high-risk situation. She's very alone, right? And it seems like even though the neighbors have tried to get some services or some attention to the situation, this is unfortunately how it looks like to the law enforcement. And law enforcement not always is trained. They're trained, they have to, as many of you may know that they are trained to, take domestic violence trainings biannually, twice a year, and they're mandated to do it. Oftentimes the nuances of how it appears is not read and understood as easily, right? This is an older couple, and there are so many different layers to it that it's, and when I said, Tom was never arrested because of his age. So he's elderly. There's this understanding that because they are older, they're not capable of violence, right? Why would they do that? They're married, they've been married for 40 years. So these are things you're going to hear from law enforcement as you kind of have a conversation with them. I want to talk about Roger's story, on the other hand. Roger, 82, was placed in a long-term facility when his ALS became severe and his family members could no longer take care of him. His family became concerned when they saw bruising on his arms and back. Roger was not able to speak and could not tell his family how he got the bruises. Roger's family asked the staff about the bruising, but were not satisfied with the explanation. The family also noticed that Roger became upset and agitated when a certain aide helped bathe him. They suspected that the aide was hitting Roger and called law enforcement. Now, understand that these are two cases from a long list of cases. If you even look into the New Jersey, the Department of Justice website, there's something called abuse stories, and you'll see the number of elder abuse situations that unfortunately occur and are being, some of them are being prosecuted, some are not. So let's understand, what is elder abuse. Any knowing, intentional, negligent act by a caregiver or any other person that causes harm or serious risk of harm to a vulnerable adult comes under the definition of elder abuse. So what does this look like? What kinds of abuse are we dealing with over here? There's institutional abuse, right? Which may occur in nursing homes or other residential caregiving facilities. It can include physical, sexual, emotional, financial abuse towards an elder. And it could be, inappropriate use of restraints, failure for staff to comply with reasonable requests that an elder might make, over medication or under medication as a means of control. Sometimes their property is stolen and they deny the right to the client spend their own money. So we hear a lot about the institutional nursing home types of abuse, mostly in the media, as compared to ones where personal family members are involved. The second type is financial abuse. And you must have had the tons of cases about elder abuse scams, Ponzi scams, all kinds of people reaching out, asking them to invest in property or invest in some scheme that's going to help them build their finance, and it's actually the opposite. Improperly using a vulnerable senior money or other property. The third, the main type, is abuse by children or family members. This is the largest cases that the perpetrators that are reported are primarily, and we look at the statistics a little bit, are primarily family members, which is really unfortunate. A caregiver might misuse an elder's personal checks, credit cards, accounts, things like that. The category also includes neglect, which is a failure of a caregiver to fulfill his or her obligations. And this can be intentional, as a means of power and control, as a means of making sure that the other person is actually benefiting from having this, having the elder person in their care. And sometimes it's just passive neglect, right? Not providing the food, medication, transportation for a medical appointment, all of that. The fourth type is domestic violence amongst older couples. Typically, elder abuse and domestic violence are treated separately, which unfortunately there's such an overlap that many folks who are in nursing homes have almost normalized it and have never actually reached out for services or got support for it. The fifth one is a little controversial, and I just want to talk briefly about this because you may hear about it, is self-neglect. Now, the reason it is controversial is how can this be considered elder abuse? There are a number of questions that need to be asked when trying to determine if self-neglect is occurring, if an individual is considered competent. As all of us know, we deal with like cognitive, decline during when we're working with older adults. If they are competent but choose to neglect their personal health, we have to ask if this is abuse. And particularly if it is, I guess, thought about, like they know this is happening, and is intervention, particularly if it's involuntary, appropriate in cases of self-neglect. So statistically, as a form of elder abuse, self-neglect actually represents the highest percentage of cases of elder abuse, which is really fascinating if you kind of look at the dynamics. There's an estimate that 40% to 50% cases reported to Adult Protective Services are actually self-neglect. But again, I would really caution you to see how we perceive this as neglect, as abuse, and how do we then tailor the interventions accordingly. So now that we know what it looks like, we look at trauma, right? How do we think about trauma in association with work with older adults? Now, traumatic stress, there's so many different definitions. This is the one that I particularly like, and I'll tell you why. Traumatic stress refers to the emotional, cognitive, behavioral, and psychological experience of individuals who are exposed to or who witness events that overwhelm their coping and problem-solving abilities. So the keyword to review in this is overwhelm. So most of us, all of us, irrespective of our age, have ways to deal with negative traumatic events in our life, right? We sometimes some stay with us longer than others. Some have more intense traumatic responses than others. But typically, when we say that somebody's experiencing a traumatic response, is when their natural abilities to manage it feels overwhelmed, right? Which is why their ability to really deal with it in a way that's positive for their health doesn't happen. So that is when we call it traumatic stress, when it goes over, because some stress is good. We need stress to be functional, to be productive. But when that goes over the line of regular stress, and it impairs our functioning, impairs our ability to live in a healthy, in a manner that's causing well-being for us, that's when it's a problem, right? So very briefly, we're not going to talk too much about the brain, but I think it's really important to understand how trauma impacts the brain and how this really impacts older adults in a way that you can see the trauma responses. And there's some of those trauma responses are mistaken as well. So when faced with a threat, right, many of you have taken the clinical class with trauma, so you probably, understand this, but just as a refresher, when faced with a threat, the central nucleus of the amygdala is the piece that we really have to learn about and how that gets activated. And that then activates the corticotrophin releasing hormone, right? When the amygdala is sensing danger, it sends out this alarm signal. Imagine it's like sitting in a fire facility, what is it called? The fire brigade place, the squad. And there's these alarms going off that there's danger. And the moment that amygdala gets activated, it activates the CRF, right? And which then stimulates the cells in the locus coeruleus. Now, what happens is that when the amygdala gets activated and sends the message to the hypothalamus, then you have these chemicals, these epinephrines and norepinephrines that are being released to respond to the danger, right? The perceived danger. And when this alarm gets sent out, there's this little let me show if I can show this to you. This hippocampus, it's a horse-shaped organ, in the in our brain that's really the place for language and memory. When the alarm signals go off and the whole brain is trying to respond, the body's trying to respond to it, the cortisol that is released gets depleted, right? And depletion of this cortisol shrinks the hippocampus, which, if you think about it, is the place of memory and language. And when that gets shrunk, what does it affect? It affects our memory and our language. Now, for older adults, if they have experienced a traumatic episode or have cumulative traumatic stress from before, oftentimes folks will say, oh, they don't remember it because of the age. And that could possibly be true, right? Because we know that as we get older, our cognitive abilities decline. But it could also be related to the traumatic exposure. But unfortunately, we're not asking those questions, right? So this person is being told that, oh, they're not able to express it, or they don't have memory because of their age-related, health issues. And where we could have asked some questions to understand what's happened that causes them to be in the current state that they are in. And then they're also not getting the services they need to really address the trauma. So from a prevalence and scope perspective, and I can't see all of you, so if anybody has questions, please jump right in. The 1 in 10, look at the numbers, okay? 1 in 10 older adults experience some form of abuse, and 60% are family members. Think about that for a second. And only 1 in 24 reported. So it makes us wonder how many older adults are out there that are not receiving the services that they need. And how is then, and we know that when, trauma, whether it's childhood trauma, adolescent trauma, adult trauma, impacts our health in many ways. We know that by now, right? Whether it's heart problems, cardiac issues, neurological issues, gastrointestinal issues, there are so many ways our health is impacted. And unfortunately, we tend to focus on the physiological piece of it, or what the person is experiencing, without connecting it with what may have happened and how that may be impacting them. I'm not going to go over the slide that's just there for your reference. So power and control wheel is something we use as a tool to assess for trauma, right? It can be used very conversationally when you're assessing the existence, the frequency, and the severity of abusive incidents. The Duluth model, as many of you may have heard, is like our original model for the power and control wheel. And since then, they've been developing power and control wheels for specific populations and where the challenges are specific to their belonging to a social group. So we have a wheel for folks in the LGBTQ group. We have for immigrants, and similarly for older adults. This is a wheel that really addresses the specific kinds of abusive behaviors that we see within older adults. I found this really helpful when I do my assessments. Rather than have like an intake sheet with multiple questions, I very conversationally ask these questions. If you look at misuse of privilege, just as an example, right? It says claims you promised things you didn't, you didn't, right? So you said you would say, give me this money or make this property out in my name. And when the person says, I don't remember doing that, oh, because you're old, you forget everything. So, but you did tell me that you would give me this FD, or you'd put it in my name, or you'd give me this amount of money. So oftentimes these mind games that are happening, and our elder clients or older adults sometimes don't know whether they really made that promise and now they can't remember. So oftentimes this is used as abusive behaviors, threatening their vulnerabilities, right? Denying them access, for example, to traditional events, like not letting them leave the home, or telling them that nobody wants them to be there, they're boring, they talk too much, all kinds of things. So many of those behaviors you may actually be able to check in when you're checking in with your clients, asking those questions. And if you go down this wheel, quite often, many of these behaviors will come out even in the conversation, right? But when you go in with this framework, you're listening to those things, you're hearing what the client is saying, and you'll be able to really make your assessment in a very structured way. I have another slide that discusses some of these behaviors that you can refer to at in your own time. So let's talk a little bit about risk factors. I want to make sure that we have enough time, so I'm just rushing through this a little bit, but we can always go back to it when we have a conversation. So caregiver stress. We often talk about caregiving can be highly stressful. We all know that. Many of us are caregivers for our children, our older parents, our extended family members, and sometimes caregivers don't have the required skills. They don't have the support system. They themselves don't have the resources and are ill prepared to manage that, right? So now they're responsible for an older adult with multiple needs, and which is why quite often abuse happens, right? And victimization happens for the older adult who's also dependent on this caregiver. An older adult's dependency increases when as they get older, and as that increases, so does the resentment and the stress of the caregiver, right? So it's like parallelly happening together. And individuals in poor health are more likely to be abused than individuals in better health, right? And as we get older, health becomes a problem for all of us, right? So how do we then make sure that, folks out there, the systems are well trained, well skilled to really identify that, provide the support they need, that both caregivers need, as well as clients. And then, of course, there are external stress, such as financial problems, the employment-related stress, additionally, family stressors, etc. Those clients who have intellectual incapacity, right, dementia, stroke, are unable to really function in a basic level, have persistent mental illness, for example, severe depression, they are also, obviously, these are all risk factors for victimization. So what about, Luann, you have a hand. Yes. I
It's
can't see you,
also
but yeah,
risk
go ahead.
factor when we serve elderly whose family members are not involved, or they're out of state, or they literally just have no involvement with their loved one and they're isolating, and then
Yes.
they let us in to kind of help just be a companion, and then we learn about their health issues and that they're not taking their medication properly, and so all of those things
Yes.
snowball into bigger risk concerns. And I mean, all we could do is over time have them trust us to kind of help get services that they need, or at least let us take them to a doctor or whatever. But you can't imagine how many elderly exist with no family members
Right.
to help them even pay bills. We've had to sit and do budgeting and actually help them pay their bills, and it's so sad.
Right.
Thank you, Luan. Thank you for saying that. That's such a great point. And it's interesting because as a risk factor, sometimes having family is a risk factor, or not having family, right? So both of those can be risk factors. Like you said, the isolation and not having your loved ones close by. And then sometimes you're living with a child, your son or daughter-in-law, or your family member, and that is a risk factor. So it's really interesting, and that, which is why I think we need to do like a case by case, assessment of each situation is so different. Lauren, were you saying something? I'm sorry.
Oh no, I thank you, Luann, for mentioning that. And I share with students and colleagues as well the importance of really understanding the relationship, because as Dr. Ketchapal mentioned, the relationship can be seen as a risk factor and a protective factor, depending on the mechanism, the environment, and also the history of the family. So I think that that's also so important to recognize and honor, because there's just been many instances in my practice where perhaps caregiving relationships have gone not the way we'd hoped, perhaps not quite abuse or neglect, but definitely of a concern. And it's actually in response to perhaps earlier points of the relationship between adult child and parent. So it just, I'm so thankful for this conversation because it enriches our work and helps all in this room understand how we intersect as a, trauma expert, Dr. Ketchapal, as someone who works with older adults, myself, all the students and colleagues and professionals in the room, all of us are doing this work together from different little corners of the world.
Thank you, Lauren. Absolutely. You're so right. I mean, there's so many varied situations and varied multi-layered needs that we really have to look at it in, in its entirety rather than like bits and pieces. And I, as somebody who's working with trauma, I always look at perpetration and victimization. Those who use violence against others, right? I hate to call them abusers or perpetrators. I would prefer to call them as individuals who are using violence, in their relationship with others. We also need to look at them and their risk factors, right? So for perpetration on an individual level, there could be, mental illness, there could be use of past or current drugs and alcohol. There could be physical health problems, disruptive behaviors, childhood trauma, right? Familial trauma. So we don't know what we are dealing with over here. And this person may also need the level of support to be able to take care of their parent or sibling or whoever it is that they're taking care of. So I think that not having adequate coping mechanisms, not having adequate coping skills can also be a huge risk factor for abuse perpetration. When you look at relationships, right? Sometimes there's a high financial and emotional dependence upon a vulnerable elder. If I'm dependent on my parent for my financial sustenance, right, that creates this, if I don't control this person, then I am homeless. I get, left out of the house. I don't have, money or food. And so therefore I need to be able to make sure that I'm controlling this parent who is allowing me to have a certain level quality of life or sustenance. Past family conflict. Sometimes families have conflict and people remember that. And as they get older, a lot of that is left unaddressed and it comes back in various ways, right? And abuse is one of those ways, right? So it's unfortunate, but even between siblings, there's disharmony or relationships that happen that can cause that. Now, in institutional violence, for example, in facilities, right? You can also see some of these relationships that occur between the perpetrator and the victim, right? So depending on what the perpetrator's past employment life has been or career, trajectory has been, or their family experience has been, oftentimes it comes out on the person that they're given the responsibility of taking care, right? Unfortunately. And finally, like you see the social in institutions is, staffing problems, there's lack of qualified staff, there's funding issues, staff are burnt out, there's stressful working conditions, lack of supervision, all of that, right, causes, are risk factors for perpetration. So we really need to do a very in-depth assessment of what's causing this to happen and look at all parties who are concerned. And from an organizational perspective, in social work, we talk about micro, meso, and macro. All of that has to be reviewed very carefully when we are doing our health plans. So just quickly about the impact of elder abuse, right? We know that, of course, there are physical bruises. There is pain and soreness and nutrition, hydration issues, sleep disturbance, exacerbation. We know that when we are emotionally unhealthy, it impacts our physiological health. We know there's a connection between our physical, emotional, and spiritual health. And there's increased risks of premature death. So it causes a lot of long-term problems. Psychologically, distress, depression, shame, guilt. A lot of elders feel a lot of shame that say they somehow have caused it, as do many of our victims, irrespective of their age, that somehow the abuse is their fault and they have been responsible for not either stopping it or not reporting it, and therefore now they have to endure it. Especially if it's family members, there is the sense that it's my child, I'm not going to report it, they're going to go to jail, I'm just going to, endure it, and I'm going to stay out of the line of fire. Like that's kind of the mentality. Post-traumatic stress, increased risk of developing fear, anxiety, it's continued, right? Financially, 28 billion of annual losses incurred by older adults. So there are layered sort of impacts, not just currently as you're working with them, but also moving forward. I love these little visuals that are provided to do a quick, I keep them in my office as just things to refer to. So I would encourage you there in the slides, and they're also available in ngca.acl.gov. You can download them, you can print them out, and you can use them as visuals when you're talking, whether you're doing teletherapy or you're meeting with your clients in the office. You can use this as quick reference points to really assess for what's happening, whether it's emotional abuse, physical, and not, as you know, not all abuse is physical, right? There's a lot of emotional, verbal abuse that goes on that is not often, assessed for, but which has long-term health, impacts. So I just put these in there, but the impact of trauma is 300% higher risk of premature death. Just think about that. Hospitalization, emergency service, think about the financial, losses that go with it, nursing home placement, higher psychological distress, health problems, bone and joint. Sometimes people will say they feel panic attacks, right? I feel like my chest is going to burst. And in many cultures, there are different ways of expressing that. And people think, oh, it's a cardiac issue, refer them to a cardiologist, right? Everything seems to be okay. You're doing fine. Your medications are working. But this person is not able to tell someone why they're getting these sudden palpitations or panic attacks in the middle of the day, right? But we're not asking the right questions. So that is when you're listening to these, I'm not saying it always there is a relationship. Maybe it is a cardiac issue. Maybe it is a primarily a health issue. It's something, an impact of the medication that they've started, but it could be other things as well. So the point I'm trying to make is it's really important to do like a thorough assessment. Excuse me. So many older adults cope, right? They manage. You're seeing them when they're older. So they have somehow survived it and they have been alive. And how there's denial minimization, especially if the person using violence is their child. There's a lot of shame and guilt that prevents them from reporting it. And sometimes avoidance helps them to cope. I don't want to think about it. I don't want to talk about it. I hear that a lot. I don't want to talk about this. It makes me feel unwell, right? I have faith in God. God's going to take care of it, right? I've always relied on spirituality. I have my person. Everything is going to be fine. And then, of course, the isolation that we discussed a little while ago is the shame and guilt. Sometimes they don't want to go out. They don't want to talk to people. They don't want to respond. They become very isolated. And that's like a vicious cycle that only aggravates, exacerbates the abuse. So there are some protective factors for victimization, right? I always talk about connection and connectedness. So if there's one thing I want you to think about is how do we create connection and connectedness for our clients, for the older adult community that we're working with. But if we're working in individuals or you're working with a group of people, how do we really nurture, facilitate connection? If there's one thing that I would like you to take away from this is this piece of it as intervention, is reduce the isolation and increase connection. And when we talk about resilience, connectedness is such a big factor that helps a person survive terrible things in their life, right? We can't control what happens to us, but we can control how we deal with it. So there are some barriers to seeking help, and we talked a little bit about these things before, so I won't go over it. But lastly, I just want to talk about trauma-informed practice, right? What is it? Refers to systems of care that establish the importance of understanding and recognizing trauma as both interpersonal and sociopolitical emphasizes the impact of human functioning and develops effective service delivery models. So TIC, many of you may have studied about it, many of you may not have, but I do want to just make sure that you have this visual in your head when you're working with older adults, is understanding that trauma impacts all of us. Trauma happens. We've all in some part in our lives, points in our life, experienced trauma. It is something that exists, right? Whether it's spoken about or not. Recognizes that there are signs and symptoms of trauma. If somebody is becoming agitated, somebody has memory loss, somebody is completely hypo-aroused, completely numbed out, or somebody is hyper-aroused, getting really upset and angry and agitated, to keep in your mind that this might be a trauma response, right? And really focusing on not actively re-traumatizing the person. You're asking questions that hopefully are not re-traumatizing this person. You're responding in a way that really helps you to integrate this knowledge and provide compassionate, empathic care, right? Even if this person may be verbally like saying things that you don't want to hear, but because you have the trauma-informed approach, you are responding in a way that's not re-traumatizing the person. So I'm not going to go through this one, but I want to stay with this last one, is what do we do? Like now we know this, what do we do? It has to be a multi-pronged approach, cannot be one, right? It has to be multi-pronged. We have to create awareness, educate people. You're all going to go out in the community and you're already doing it, but really talk about this. Talk about this in your families, in your communities, on the dinner tables, is how are elder adults impacted by trauma, by abuse? What does that look like? Why are we only talking about intervention? Why are we not talking about prevention? If we can create awareness and prevention, we don't have to intervene, because now this elder adult is a healthy person living the last phase of their lives happily, right? So in terms of intervention, trauma-informed, culture responsive, understanding that culture, right, and advocacy is an overarching point that really sort of is there in every action that you take, right? It is something that overrides, is an overarching value system that is sort of guides our work with older adults and with actually any individual. Culture is such a thing, and I just want to say one thing about that before I forget is, in many cultures, taking care of elders is different than other cultures, right? So really understanding what that means, right? Even though I don't have the capacity, I cannot tell my community that my parents are not living with me. And what that looks like is when my parents are living with me, I'm outwardly doing their social obligations to my community, but inside the house, behind closed doors, I don't have the capacity and I'm pushing around, being resentful, sometimes using physical violence, or criminal restraint, will not allow my parents to leave the house because I don't want anyone to hear what's happening behind closed doors. So you have to be very clear about what culture means for this person, right? When you're doing an assessment, whether they're in a facility, in a nursing facility, and what that means. I would much rather go home than stay in this facility, because now everybody thinks that my children don't want to take care of me. And culturally, that's unheard of. So even though I may be safer in a facility, I want to go back home, right? Or I may be home and not feel safe, but I want to go to a facility because I don't want to go to a facility because what are people going to think? So you have to sort of understand how culture informs both caregiving and perpetration of violence, right? And of course, finally, the coordination. Please sit on multidisciplinary task forces to talk about how, the criminal justice system, healthcare, education, social services, none of us can work in isolation. We have to work together. So what are we doing to really get to be on those tables where people come from other interdisciplinary aspects to really discuss elder care? Right. So here's, intervention, safety planning, all of that, legal, psychosocial care, medical care, all of those have to come together. And resources is, I've just put down some organizations that have been very helpful to me that are on a list in my computer, very easily accessible, where I can access resources. And I always also give this to my client so that they also have the ability to access what they need at any given point of time. So that was it. Thank you. I'm sorry I went through a lot of information very quickly, but I'm more interested in talking to you. I'm going to stop sharing so that I can see your faces and we can have a conversation.
Thank you so much, Rupa. That was so informative, important. Thank you. And please ask questions. We're happy to respond best as we can.
Yeah, and even your thoughts and your experiences with the population, I would love to hear from you as well. We all learn from each other, so feel free to just jump in and comment.
I put in the chat about the importance of religion
Mhm.
in using that as a what do we do now kind of thing. And if religion is something that is important to a senior who has a strong belief system and finds strength from
Mhm.
that, you know, to make sure that we utilize that piece of their whole picture, you
Yes.
know. And I know, like, just using my mother-in-law as an example, she's very, you know, she's very religious, but she just witnessed her husband through hospice and passing and the trauma of that. I noticed she kept repeating certain things over and over again. And I know, and I saw that as a way of validating her feelings and needing to get them out. And even though it was repetitious, she just needed that validation of, you know, that she made the right decisions of things and so on. And then I saw her quickly turn to church, you know, and so that's a source of strength. So finding those sources of strength
Yes.
for for the seniors and the elderly are very, even though even if it's small, you know, something small, it's means so much.
Absolutely. I completely agree. Religion and spirituality, you know, and the way that seniors may be practicing it can be huge resources in the intervention, right? And when you're doing a treatment plan. I think that sometimes religion, in my experience, Luann, has gone one way or the other, and I'll explain why. Sometimes, you know, in many religions, you don't question, you know, what you're given, right? You endure it. So when they're in an abusive situation and there is this idea that, you know, what have you done about it? Have you talked to somebody about it in the past? What are some things that have been helpful to you? I have heard them saying, well, this was given to me, and if I question it, I'm insulting, I'm challenging my, you know, my God, right? Whoever my this faith I have, and therefore my job is to endure it. And in many of the religions, there is endurance is seen as a strength for especially for women, right? And so I don't question it, I endure it. And so as a clinician, I'm sitting across from them and I'm thinking, how do I use that in a way that they're not feeling like they're going against what the religious belief is, but at the same time, I'm motivating them to do something about it, right? That yes, you're enduring it. There's a huge amount of strength in trying to tolerate this pain. But, and this is not about the grief and loss is separate, but how do, you know, you do something, what would your children, and sometimes I, you know, resource the children because that connection, that relationship oftentimes motivates them. But what about your children? Do you think that is helpful to them to see you suffer like this? Like, what would they think? And what could you do that's going to help the situation in a way that they feel at peace, because they see you like this and they leave and they're worrying about you, right? So using different things, but you're so right that religion is such a huge resource for my older adult clients. Absolutely. Absolutely. Thank you for saying that.
Well, I think also to Luann's point, it's interesting again to see how these things change in different environments and in different relationships. So, in one way, religion can be a supportive outlet and something where, as I've shared with my students, clients, and patients, folks you work with might ask you to pray with them. They might talk about their own prayer rituals. And that's part of our spiritual assessment process, getting comfortable and understanding that. And I think, Rupa, as you're sharing in your story and in your presentation, how it enacted in a different way, another mechanism, another factor is how it could impact someone to the event of not reporting, not sharing, not disclosing because of that added layer of feeling like I'm to endure this, or this is, you know, what God or what my God would want, or I'm learning a lesson from this. And that, again, going back to social work practice, preparing ourselves for that, understanding that, speaking about that, honoring that, and thinking about how we can be curious about that with the people that we work with, and think about, as Rupa said, bringing in other sources of knowledge and information to help individuals live a good quality of life that's safe and meaningful.
Yeah, thank you, Lauren. And many of you, I can see some of my certificate students work with older adults or work with religion. I don't know if you have any thoughts about this and how we can really resource religion or spirituality in the work that we do. Because one of the things, again, while somebody's, if I don't hear somebody jump in, Zumna, you going to say something? Sorry. Zumna is our MSW and MDiv person, so she's working with divinity as well. So maybe she's not going to say anything. Okay. Sometimes I think that, you know, with older adults, one of the things that I ask is, and they smile at me because I ask about, what do you do for your soul? And I ask this to a lot of my clients, right? So you have your family responsibilities, you know, you've got your professional responsibilities, you've done all of that, you know, now you're retired. What have you done in your life for your soul? And they're like, what do you mean? I'm like, what is the one thing that you've done that just makes you happy? Like, not that it makes sense to you, like, or to anyone else, but it makes you happy just thinking about it. And I think identifying many of those, right? Even it's like sitting and knitting, or sitting and, you know, watching the ducks in the water body that's outside my apartment, right? Whatever it is that makes them feel, and clearly we would like to have them think about ways that they actually actively engage rather than listening to music or reading a book or something, but something that they're actively doing. If they're able to do it, right, physically, both, and or emotionally, and really highlight some of those things. And they'll say, oh, when I was young, I used to write poetry, but I don't do it anymore. And then that being having the curiosity, oh, what kind of poetry did you write? Can you read something out? And really, again, rebuilding that. So in terms of intervention, I'm somebody who comes from a very non-talk therapy space. I come with really engaging in doing things with the client together, whether it's music or drama or drumming or mindfully walking or you know, breathing or praying together, reading scriptures together, reading poetry together, storytelling, things like that. You might want to use that and ask them, what is it that you really enjoy doing that you don't do anymore, maybe, and that we can again nurture. So anyway, I was just thinking about things that we could apply as resources for our clients. What about others? What have you done with in your work that has been helpful? Or not?
I have a question. It doesn't really,
Yes.
Kathy,
Yes,
do you want
Shannon.
to go and it has more to do with that? You can, I don't mind.
No, go ahead. I'm happy to go after you. Thank you.
Okay. I was just going to ask about the overlap with technology, especially like I'm thinking of the scams, and I know in my work I've seen older adults who their kids were in their bank accounts and stuff like that. So all of, like the technology knowledge and like what we can do as social workers within that.
That's such a great question, Shannon, because and maybe Lauren can jump in as well. There is a huge amount of financial scams that are happening. And if you talk to anybody in the prosecutor's office, they'll tell you the largest number of elder you know, abuse cases are financial frauds, right? Happening through these schemes that they get caught up in. And I think this is where, you know, the technology piece, whether it's cognitively or whether it's just from a, you know, it wasn't there when they were, you know, in the profession and we're using it. They don't use it as often as we do because it's part of our work life, right? And so even like putting in money. I've heard of like, like you said, like you're doing your bank accounts and somebody asked for a bill and you ended up paying more than you're supposed to. And then it's like, oh, I don't know where that money went. I think here is where sometimes if you have healthy family members who can really work with the clients, and which is why I also say like supporting family members to support the clients, right? Is really working with family members, making them aware of this. And yeah, Lauren has put in a great resource in there, really telling them that this is something that maybe like we do with children, right? We have some parental controls in areas where you may feel that they may access information that's not helpful for them. So similarly, having some sort of a ability to really support the older parent or older person. I think the problem happens that I don't have an answer to in facilities where they may have more sort of isolated in some ways, where they don't trust the person to look into their bank accounts. And so they're trying to do it on their own. And if the family is not involved in a more intensive manner, that's where the abuse happens. So I think as social workers, the more we know about this and the more we support caregivers to make sure that the technology piece of this is managed and really not wait till something bad happens, right? So kind of when you're doing an initial assessment, whether you're doing it with the client or the parent, or with the family, I always involve that question. I always talk about the technology piece. What are we doing about that? How are we managing that? What have you done in the past? What's helpful? What's not helpful? To see that that's definitely a conversation that needs to happen. So thank you, Shannon. It's a very long answer to a short question, but
No, thank you. That's helpful.
I just want to add, as someone practicing as a social worker with older adults, that your question, Shannon, is so important and it's so layered, because there's many different kind of factors we can consider with respect to technology and how it could be incredibly empowering, but also incredibly risky. And I will say that all aged individuals are at risk for these types of scams. I've gotten my identity stolen twice through jobs, and my wallet was stolen at a park, and that was another way. So, there's just all these things. There's lots of desperation in the world, unfortunately, and the sophistication of technology. I mean, people can literally copy websites, and it looks like you're on your bank's website, and it's not your bank's website. And as Rupa mentioned, we mostly folks in our space today are digital natives. We grew up with computer class. Technology was something we actively used to learn and learned about. And we still rely on. We're all connecting through technology. Respectfully, there are other professions to this day that don't produce or support digital nativeness, right? And then also earlier generations have different relationships with technology. So I put something in the chat. It's OATS. It's called Older Adults Tech, and they do wonderful programming and have information. And I think that one way to address this, in addition to what Rupa mentioned, is to also encourage and support people who are not familiar with technology to become familiar. And in my work, sometimes individuals might say, nah, it's not really, I'm not interested in this. And we can talk about the benefits beyond socialization, because unfortunately and fortunately, our world is leaning more towards being tech-based more than ever. We're meeting virtually, we're getting MSWs virtually, like we're doing therapy online, like everything is happening online, and it's creating a lot of access, and we love it. But it's a reason also to speak with people about empowering them to feel comfortable and autonomous, and as an opportunity for self-determination to get more educated and connected to using different technological services. And I think also with respect to Rupa's comment about long-term care, it's something definitely that we need to be attended to, because of individuals across the life course are accessing things that are potentially harmful that we're not aware of, and in independent isolated rooms we're not monitoring that. So asking all age persons what their relationship is with technology is really important and could be a really good conversation starter in your work.
Thank you, Lauren. Lauren said that really beautifully, way more than I would have imagined using the right words. So thank you for the digital expertise. You're so right. Kathy, Kathy, were you saying something? And then I think I saw Luann's. Yes, Kathy, go ahead. And then Luann's.
No, that's okay. I had a question, but unfortunately I have a 1 o'clock call,
Yeah.
so I'll have to drop, but this
Put
is
it in the chat, and I'll respond to that when I talk to you.
Oh,
Soon.
sure. Basically, it's just really quickly, it's about um, caregiver burnout and just protection. I see this personally and professionally. Like
Mhm.
my mother has complex PTSD, and so it's very triggering to help her. But of course, she's my mother, and I want to help her. So it's like finding that balance of taking care of
That's
her,
tough.
taking care of myself. So unfortunately, I have to go, but
Thank you for that question, and
thank you.
I'll remember to respond to that when I
Yeah,
see you
thanks,
next time.
Kathy.
Thank you
Thanks.
for
Please
coming.
feel free to reach out to me too. Yeah.
Luann, sorry. Go ahead.
No,
Go
I
ahead.
just, Shannon was, I just heard a statistic on the news that scams via phone and computer is a $691 billion business. And I'm wondering how much of that is from with seniors, because like you
Yeah.
said, everybody gets scammed and, whatever, but I would try and do some research to see how much of that is senior driven because they're such easy targets,
Well, the assumption is, the assumption is that they're easy targets, although we know that many older people are very savvy and unfortunately are not falling for these random text messages that are asking you to pay easy pass tolls when you don't even own an easy pass, for example, which is an active scam going around right now. And the other point, as someone who's very recently experienced something pretty concerning, but luckily everything turned out okay. The fraud professionals I've spoken to also identify individuals who have, because everything is accessible online, unfortunately, despite any sort of password protection. So individuals who have a great deal of student loan debt or any kind of lower credit score are also being actively targeted by scammers, opportunities to unload your student debt or things like that come across. There's always those mail-ins that ask, say that you won $1 million, which if you've seen the movie Nebraska, it's an unfortunate kind of heartbreaking story of someone who actually believed that when we know it wasn't really true. And then also individuals where English is not their first language, also incredibly vulnerable to these people who are again, they're committing the most sophisticated levels of crimes. It's something unimaginable, even to someone like myself, a millennial who grew up with technology, accessing technology. Again, like you think that you're on the phone with Bank of America because it says Bank of America, and it's not. So one way to verify that is to call them back. Call them back. If anyone's calling you from a number that is not Bank of America or something of that nature, do not answer because they should always be calling you from a branch. And there's a lot of other recommendations, I think, on the DOJ website, elder abuse website, et cetera. But I would, it's just really devastating to think about. But yeah,
Mhm.
yes, your local prosecutor's office as well. Thanks, Rupa. Absolutely.
That's how I used to learn about like the cases, and the more we know, then we can then, provide safety planning accordingly with our clients because we know what to look out for, right? It's very sophisticated now. It's very difficult to find it and identify it, and it's really difficult. But thank you all. I know we are past time, so thank you all for being patient and listening,
Thank
and joining, and
you.
thank you,
Good
Lauren,
seeing
for
everybody.
organizing it.
Rupa, thank you so much for all this wonderful information. Like we said, we'll follow up with recording and the slides prepared. And please continue to connect with us. As you can tell, we both really enjoy working with students and educating and sharing our wisdom and practice experience. So connect with us. We really enjoy, supporting your work, your future work. And thank you all so much for being here for this important conversation.